Welcome back to the channel, y'all. It's Yaz back with another video. Today we're doing something a little different, y'all. We just gonna sit down and have a little chat. Normally on this channel you'll find lifestyle, wellness, travel, and like beauty content. But your girl is a whole registered nurse, y'all. I know. And I have talked about it on this channel, like getting ready for work with me, or just like briefly talking about how I work in the ER and stuff. But I haven't talked about my full experience. I haven't talked about my NCLEX experience. I haven't talked about my nursing school experience, the transition from being a nursing student to a new grad nurse and working at the bedside. And I want to talk about it. Like, I just feel like I'm in a place now where I can talk about it. So we're doing that today. So without further ado, let's get in this all things nursing chat. So nursing to me is something that I am a big advocate for. I support it through and through. I'm proud to be in this profession. And I think nursing scares a lot of people because they get told the bad things about it. Like, don't get me wrong, nursing isn't all rainbows and butterflies. The bedside, sometimes it really does suck. The bedside's not easy, and yeah, sometimes it really does suck. But some people think that as a nurse, all you're going to be doing is like cleaning patients, wiping butt, and giving just like home meds and stuff. But that's not the case. There is so many different types of nursing that you can go into, which is why I absolutely love this profession, because there is something for everybody. You don't have to be that med-surg nurse that's miserable for 12 hours, cleaning people and just giving, basic meds and stuff. Not knocking the med-surg nurses, but there's more to nursing than just that. For example, there's cath lab nursing, OR nursing, flight nursing, trauma nursing, and there's also soft nursing. There's nurses who you don't even have to see a drop of blood like throughout your whole shift. There's nurses who are doing aesthetic nursing that is just like you doing Botox or skin health. There's community health nursing, home health nursing, where you don't even have to do like blood cleaning people. Sometimes you just pop up at a patient's house, make sure they're good in their own home, and then you did. Like, there's just so many different types of nursing that you can be. So don't let it scare you to the point where you're thinking that, oh, you're dealing with blood, or you're dealing with vomit, or you're dealing with poop. Like, no, babes. No, like, there's some nursing jobs you can just sit behind a desk and look pretty. There's remote nursing jobs. There's travel nursing jobs. Like, the sky is the limit with an RN license. So if you've been thinking about getting into nursing, but say you're scared of blood, or you're scared of vomit, or you feel like your stomach's not strong enough, girl boo, get that RN license and you'll figure out what you want to do from there. Things that I wish that I knew before going into nursing school. There's a lot, y'all. If you are thinking about going to nursing school, like I said, I highly recommend, but I think that it's important to go into it with a certain mindset and definitely know what questions that you want to ask. First things first, something that just comes to mind to me about something that I wish that I knew before nursing school was getting a nurse extern job or a PCT, or just being affiliated with a hospital prior to getting your RN license. As a new grad nurse, it's not going to be easy to get a job right after nursing school without being affiliated with some type of hospital or company. Everyone's experience is different, but I know that there were some people in my nursing cohort where getting a job was not, it wasn't instant like this, like fresh out of nursing school, because not a lot of people are just going to hire you, fresh out with no experience, which is why I think it's important to kind of get your foot in the door first. When you have your foot in the door, at least an employer, like, they know your name and you're somewhat affiliated with them, so that way you kind of have a higher chance of getting a job fresh out of nursing school. I actually got a nurse extern job like I think 2 months before I graduated nursing school, and it worked. I mean, it was a short time that I was a nurse extern, but I got hired at that same ER that I'm working at now, and I started instantly. I think right after I took my NCLEX, which was like 2 weeks after I graduated, I was already working. There's nurse extern jobs, which is specifically for nursing students, and there's also PCT. It's important to get a job at some type of hospital, so that way your name is kind of already in their system and they know you, so you're not just the new grad nurse with no experience walking into a job interview trying to get a job as a nurse. I just think it increases your chances, because it's not always easy trying to get a job right after you graduated nursing school with no experience as a new grad nurse. Let's talk about finances. Everyone's financial situation is different, but one thing for certain is that nursing school, you obviously have to pay for it. And I think when you're going into a program, or you're looking at different programs, or you're talking to the advisor, talking about your financial situation and how you can get financial help is very important. So if you're looking for a fast, you're gonna get in type of nursing program, a private nursing school is the way to go. They're going to get you in quicker, but it is going to be more expensive. So if that's what you're looking at, then you need to talk about, financial aid or how they can help you, taking out a loan, figuring out how you can pay for it. And then there's also public nursing schools. Those ones are going to be more affordable, but the wait list is probably going to be a little bit longer. Me personally, I did go to a private nursing school, so yeah, like she was a pretty penny. But at the end of the day, when you're working as a nurse, you have really good job stability and financial stability. I think that a lot of people think that, oh my gosh, she went to that school, like that is just too expensive. But as a nurse, you're going to have a good job where you're going to be able to pay your loan back. And for me, the loan that I took out, they weren't charging me while I was still in the program. I didn't have to start like putting money towards the loan until I graduated and I was working as a nurse. So definitely do your research on the loans that you may want to take out. Obviously, taking a loan out, there's pros and there's cons. You don't have to pay it in full, at least the loan that I'm paying for. I just put money towards it every month. And then last thing that I think is really important before going into nursing school is being mindful that this is not something that you just do alone. Like, don't have that mindset that you're going to, study by yourself, do everything by yourself. You're not going to make no friends, and this is just going to be a solo journey. No. When you work at the bedside, if your patient's crashing and say it turns into a code blue, you're going to have everybody in that room. You're going to have a whole team. You're going to have other nurses. You're going to have the doctors. You're going to have respiratory. You can have other people there because it takes a village to do this. And I think the same with nursing school. Don't think you can do this by yourself. Make friends with people in your cohort. You're going to want to study with them. You're going to want to, just have a team to attack this journey because it is not easy. Find your people in your cohort. Obviously, you can't trust everybody. Not everybody has good intentions, but there's somebody who you could do this with because you're going to need that support. Like, nursing school is hard, y'all. So find your people. All right, let's talk about study tips and organization. So nursing school is different from any other education that I could think of because nursing school is not just black and white. There's not like a wrong and a right. When you're taking tests, all four of those options could be correct. It's which one is the one you have to prioritize. What I mean by that is that you have to learn how to critically think because that's just how nursing is. Like, you have to prioritize stuff. So on a nursing exam, they may ask you a question about the patient and they give you 4 options. And all 4 of these options could be right, but you have to pick the answer that you would have to do first, otherwise the patient might die quicker. Like, that sounds crazy, but that's literally what it is. Like, you have to prioritize. Let me give you a little example of what I mean. So say the test question is this. You're walking into a patient's room, they're satting 86% on room air, and they're showing obvious signs of shortness of breath. Here's your 4 answer options. A, are you gonna put your name on the whiteboard? B, introduce yourself to the patient. C, sit the head of the bed up and put them on 2 liters nasal cannula. Or D, walk out of the room and do nothing. So obviously D is wrong. You're not just going to walk out of the room and do nothing. But peep how the other 3, writing your name on the whiteboard, that's something you're supposed to be doing. Introducing yourself to the patient, that's something you're supposed to be doing. But we have to look at the priority here. This patient's short of breath. They're not satting well on room air, and it shows that they're not satting well on room air. So obviously we want to sit them up and put them on some oxygen so they can breathe better. And that's how nursing exams are, y'all. Because those other ones, they're not wrong. Eventually, you're going to put your name on the whiteboard. Eventually, you're going to tell the patient your name. But is that what you're going to do first? No. Priority comes first. And I want to say that was a very easy question that I just made up for y'all. But that's just an example of the test, the test that you're going to be taking. The best way to prepare yourself for priority questions like that is practice questions, not just memorizing stuff in a nursing textbook, because that's just not what it is. Nursing and just the patients are not cookie cutter. Just because two people may have COPD doesn't mean they're going to present the same. This person could have a whole different thing of symptoms than the other person, even though they both have the same condition. So you have to be open-minded and know that not everything is the same. It's not cookie cutter. Just because the textbook may say these are the clinical signs and symptoms of this condition doesn't mean that the patient's always going to present that way. So I think it's important to obviously study your textbook, get to know a foundation of like maybe the condition that you're studying for, but you need to be open-minded and just be ready for whatever, and look at the key context clues of, you know, prioritization and critically thinking. And I think the best way to do that, y'all, is like practice questions, critical thinking questions, nursing scenarios, and there's so many resources out there. While I was in nursing school, I watched a lot of Level Up RN. There's like Simple Nursing and things like that, but I do remember like Level Up RN was my girl. Like me and her went together real bad. Yeah, again, just making sure, y'all, it's not about like highlighting and memorizing things in a textbook. You have to be good at taking test questions, because what it's doing is preparing you for NCLEX. And that's all NCLEX is a lot of like prioritization questions and all of that. So practice that while you're in nursing school. Obviously, while you're in school, your teachers are going to be going over like certain topics that you need to know. So yeah, definitely make sure that you're, you know, memorizing some things about that certain topic. But when you're sitting in front of that exam, you have to know how to critically think. I also highly recommend buying a planner or just some way that you can organize your stuff. I think it's important to plan out your stuff in nursing school. It's important to know like the due dates of when certain things are due, when you have papers, when you have tests, all of that. So I highly recommend buying a planner to stay organized. And if you're not somebody who likes to handwrite things like that, there's apps, there's calendar apps. Just make sure you know when things are due, because you don't want to miss an assignment in nursing school. I don't know what it is, but you could miss an assignment that's like worth 10% of your grade. Child, you drop in 2 letter grades. I don't know what it is. Don't miss an assignment, because you will, like, that junk will drop you. Yeah, know when your stuff is due and don't submit stuff late, because them nursing instructors are a different breed, okay? Let's talk about clinicals. So if you don't know what clinicals are where you go to a hospital, you get experience as a nursing student at the bedside under another nurse. You have clinicals every semester of nursing school, and it changes. You go to like different places, different units, and all of that. I think clinicals are very important because it kind of, again, it helps you get your foot in the door, because you never know who's watching or who you're impressing. I think when you go to clinicals, it's very important to be eager to learn, but also don't overstep. Okay? Don't. And when you're at clinicals, make sure that you are asking questions and that you're showing interest, that you want to be there. Clinicals are long, y'all. There were some days I did not want to be there. Like, I'll be so honest, especially if it was like a specialty that I just was not interested in. Like, I didn't want to be there. But you can't show that, because again, you never know who is watching. If you get an opportunity to start an IV or put a Foley in, definitely take that chance. It's nerve-wracking because as a nursing student, like, you're not doing it every day at the bedside like how these other nurses are. So it's probably your first time doing it on a real person. But you should have, you know, the nurse that you're working with there, and just, you know, do it. It says a lot that you're brave enough and courageous enough to do it, rather than saying no, you don't want to do it, because that just doesn't really look good. Just be brave, do those skills if you get the opportunity to do it. At clinicals, though, it's very important to not overstep your boundary or be rude about certain things. You don't know everything that goes down in that hospital or whatever, so don't like always try to put your 2 cents in or overthink all these things, or think that your nurse isn't being compassionate or something, like, because nursing school kind of can sell you this false narrative that therapeutic communication, you always need to be compassionate and all this, and kind of just make it seem like everything's a perfect world, when in reality it's not. So at the bedside, it is a little bit more different, and I just think that it's important to, I'm trying to think of a nice way to say mind your business, because there's some nursing students who have completely overstepped. Like when I was in nursing school with my cohort, like there's just people who, like, child, just mind your business. Like, it's not that serious. Like, we not clocked in, we not getting paid for this, so why you care so much? But if a patient is on like a drip, don't mess with the pump. Just don't go into that room and just do whatever. Like, make sure that you ask your nurse if this is okay. Like, don't sit on this high horse thinking that you know so much. You don't have your license yet, so don't overstep your boundary. I think it's important when you're at clinicals to focus on doing skills, like putting a Foley in, doing an IV, you know, learning how to hang fluids on the pump, learning how to load your pump, but do not overstep your boundary, okay? Like, just know when you need to draw the line. Clinicals are long, clinicals are hard. You're not getting paid for them, and a lot of the times you are staying there for them 12 hours. You're on your feet. Sometimes they're boring because you're not doing nothing for real, but never wear that on your face, okay? Never show somebody that you're working with that you don't want to be there, you have no interest, because that's just unprofessional. At the end of the day, even though it's hard and it's long, it's going to come to an end. Let's talk about some self-care tips and work-life balance as a nursing student. I was in a full-time BSN program, so your girl was there 5 days a week and for 16 months. It was a shorter program. Normally nursing programs are like about 2 years, the traditional route, and you do get breaks in between. For this program, we didn't, honey. It was accelerated. We're getting our bachelor's and we just gotta, you know, thug it out. So I'll be so honest, y'all, self-care, as much as I care about self-care and I prioritize it and I think it's so important, there was so many times where that just was not priority for me. And it showed a lot. Do I recommend that? No, I think it's important to take care of yourself and do things that still make you happy and try to find your work-life balance. But for me, it wasn't the case. Like, I'll be honest, I was miserable, I was depressed, but I'm here now. I'm happy. I'm working as a nurse and I got that degree and I think I'm glowing now. But you asked me that 2 years ago when I was in nursing school. No. But there's little ways that you can still prioritize your self-care. Like for me, maybe doing my skincare routine is a way that I can just feel good about myself. Or, you know, eating good things and not always getting takeout. It's easy to kind of let yourself go in nursing school because you're stressed out all the time, so you're not really thinking about that. But even learning how to make a 10-minute meal for like you can have for multiple days, like a meal prep. I think things like that is important because you'll feel better when you put trash into your body. You feel like trash. Drinking water, going on walks, trying to still exercise and move your body, because exercise is really good while you're in nursing school. You need something to burn that stress off. But yeah, if I'm being completely honest, my self-care was not good while I was in nursing school. If I wasn't at school, like I was studying. Like I was never home. I was always either at Panera or the library or Dunkin' Donuts, just like sitting and studying, because I mean, at the end of the day, a goal is a goal, okay? Like I was miserable for 16 months. I'm happy now, all right? And I don't regret it. Would I do it again? Absolutely not. But I'm happy that I am where I am now. And that was just a sacrifice I had to make. Work-life balance is pretty hard too. Everyone's story is also different. For me, I don't have any kids. I'm not married. I don't really have that many responsibilities. Yes, I was still working because obviously like you need some type of income. So I was working on the weekends, but I'd be working like maybe 10 hours a week. So it really was nothing, but it was just things like just little money so I can buy gas and cheap foods for myself. But I wasn't working full time. So yeah, your girl was struggling. There's some people who I went to nursing school with who were mothers, who were fathers, who had a mortgage to pay, and like it's tough. It really is hard. The program that I did, since we were in school full time, is hard to work full time, but there are still some people who made it work because that's just a sacrifice that you have to make for, you know, for you and your family. And if that's your situation, that's your situation. You just gonna have to figure it out, you know. You gotta have that dog in you. All right, let's get into our next segment of the video, which is the transition from student nurse to registered nurse. So obviously before that you work at the bedside, you got to pass NCLEX. So yeah, let's talk about NCLEX. Let's talk about it. NCLEX is the board exam that you have to take to get your nursing license. NCLEX is making sure that you can get that license and that you are a safe bedside nurse. Everything on NCLEX is about safety, safety, safety. All right? Let me just say that first. If you are taking NCLEX and say you're stuck on a question, you don't know which one to pick, which one is the safest option? That's how you have to go into that test, because that's literally what it is. The thing that's difficult about NCLEX is that you don't know what topics you're going to get handed. While you were in nursing school, your nursing instructors kind of give you a heads up of what topics to study to be on this test. Or if the test was on renal function, all right, you know you're studying kidney stuff. If the test is about respiratory function, you know you're studying, heart, lungs, all that, and just what to do when your patient's in respiratory distress or something. NCLEX, you don't know. They just finna throw them topics at you, so you have to be ready for whatever. I passed my NCLEX on my first attempt, and I used Archer for the practice questions. All I did was practice questions. I didn't watch any other lectures, none of that. And for me, I didn't take too long of a break from graduating nursing school and taking NCLEX. Every school is different. Some people had to wait a little bit longer to get their approval to test, so you have to get that first. But my school, luckily, they sent that in a very timely manner. I think I waited 1 week before I got my approval to test. Right after my nursing pinning, I took, I think, a weekend, maybe like 3 days, 4 days, and then I started, them practice questions, because when you don't use it, you lose it. So while you're in nursing school, you're used to test taking, you're used to, answering those questions. Like, that's just what you do. That's your baseline. But once you stop doing that and then you try to get back into it, it gets harder, which is why I recommend that you don't take too long of a break. Like, yeah, you're tired. You've been in this program all this time. But babes, you're not done until you have that RN license, okay? So you need to thug it out. For me personally, I did like Archer a lot, but Archer was more difficult to me than the actual NCLEX itself. But there's also different ways to study. So what worked for me may not work for you. If you need to watch lectures, there's the Mark K lectures. His is really good. A lot of people like his stuff. There's other people. There's Level Up RN. There's UWorld. But for me personally, I liked Archer. So I would do one Archer exam every single day. 2 days before my NCLEX, I took a practice test like early in the morning. And then the rest of the day, I did nothing nursing related or like NCLEX related, and then the day before my NCLEX again, nothing nursing related, so that way my brain was fresh when I took the NCLEX. For me, I was pretty lax about it. I would study with like my friends, and I remember this day specifically. We all went to the library and stuff, and I think they're a little bit more type A than me. They had like, their ATI textbooks, they had lectures that were playing, and for me, I was just, one practice exam, I'm done. Like, I wasn't doing all of that, and that's just what works for me, but I'm just a little bit more lax, and it worked, and I was the first one to take it out of all of them. And I'm talking about, Ashley, Joelle, Morgan, I'm talking about y'all. I think this was Ashley and Joelle this day who brought like the textbooks and stuff. But that's just how they study, and that worked for them because we all passed it on our first attempt. Let me walk y'all through the day that I took NCLEX, because I remember this day vividly because I was so nervous. I took my test early in the morning, I think at like 7 a.m. because I'm a morning, well, this was prior to working night shift, but I was a morning girly. Like, waking up early, like, that's my thing. So I walked into that building scared. And it's like you're going to jail. They got to fingerprint you. They got to take all your stuff, pat you down, all that stuff, because this is a state exam. So it's, it's very important. You sit in a little room, and where like there's a whole bunch of computers and stuff. So I open the screen. The test is there. They ask you to begin. You hit begin. Child, my heart dropped. I, of course, prayed. Like, before I even started that test, like, Lord, guide me as I pick these questions because so much stuff is on the line. And then as I was taking NCLEX, I noticed the trend of like a lot of safety things. So again, you get thrown random topics at you. It could be pediatrics, it could be psych, it could be med surge, it could be a whole bunch of things. It could be maternity, Like, you don't know what they finna throw at you. But one thing that I can say for certain is safety, safety, safety. This test is making sure that you are not gonna kill somebody. There's a test question, you have no idea what to do. Like, say it's I'm gonna say L&D. Labor and delivery is not my thing. Don't ask me nothing about pregnant people. I don't know. So say I'm getting a question in regards to like something L&D related, I'm gonna go with that answer option that is the safest option. I may not know what the gravida and para means anymore, or how many weeks is the third trimester and all that. I don't. But best believe I'm going to click the safest option where this would keep this patient alive. And I did get some questions on NCLEX, like STEMI, like those emergent things. It was like basic things, like stroke-like symptoms is something that is expected that you should know. It's just like those clinical signs and symptoms. Are they having slurred speech? Are they, ANO times 1 now when they're normally ANO times 4? Like things like that, coming out of nursing school. So they threw that on my NCLEX. I do remember that specifically. Like, I don't want to come off a certain way when I say this, but for me, I didn't think that NCLEX was that bad. I truly feel like I was prepared. The school that I went to prepared me very well. And when I walked out of there, I just had a feeling that I passed. Because I was like, if I didn't pass that, then I'm getting into a new profession, because I truly didn't feel that it was that hard. But then again, there's also test anxiety. And if you struggle with that, don't get me wrong, like I struggled with that too. But there's different tips that you need. So when you're taking NCLEX, as hard as this may sound, do not let anxiety and fear control you, because you know what you know, okay? It's possible. You can do it. Don't let that anxiety control you, because you're smarter than you think. I think the biggest thing with NCLEX is the test anxiety and overcoming that. I think that's what can hinder a lot of people. It can make you overthink more and all that. So I think that's something that you need to practice getting under control before you sit for this exam. I think the main things before taking NCLEX is don't take too long of a break between when you graduated and preparing for it. Take practice tests, adaptive practice tests to be specific, not just practice tests that are going over, okay, this is cardiac, this is going to be pediatrics, this is going to be leadership. Take an adaptive test that's just like NCLEX, where you can just get any topic at any given moment, because you need to take the test that's going to feel like you're sitting for the actual exam. And if you are preparing to take your NCLEX, you got this, okay? You're gonna pass it. You got this. You've studied. You just have to trust yourself, and remember, go with your gut. Try not to overthink as much and overcome that test anxiety. You've worked so hard and you can do this, okay? Next topic is the transition from student nurse to RN, and my experience working at the bedside as like a brand new nurse, like before I even got my feet wet, all this. And I'm just gonna talk about my experience because child boo, what an experience. I'm just gonna say it. The nursing instructors are probably gonna, come at me for this one, but when you're working at the bedside and like you're actually just, transitioning to becoming a brand new nurse, you realize that nursing school teaches you how to pass the NCLEX, not how to be an actual bedside nurse. Because child, there's so many things that, nursing school is not going to teach you. For me personally, I will say I did start off in the ER, and it's also a trauma ER too. So nursing school is obviously not going to teach me some of the things that I need to know in regards to that. They don't really teach you how to work fast, how to be good at IVs, how to hang titratable drips, like, the critical stuff. It's not going to teach you that. And that's fine. But I think every new grad nurse, I think we can all come to a realization that nursing school can be pretty unrealistic than what it actually is at the bedside. So if you're a nursing student or you're thinking about getting into nursing school, don't even focus on that, okay? Like, you need to get through that program before you can kind of worry about this stuff. Nursing school is pretty like they make it seem like you have all the time in the world. All the patients and the patient's family members are so nice. The doctors are so kind and caring. Like, there's no conflict. They make it seem like so simple. Like in that nursing school checkoff, if you're trying to start a Foley on a patient, you just walk in the room, you tell them what you're doing, and you just, you do it. But in reality, I've literally had patients swing on me for putting a blood pressure cuff on them. And like, nursing school, not gonna show you that. All right, so let's just get into like when I first started. So I started pretty instantly with my orientation after graduating. I graduated like the last week of August 2024, and then I started like first week in September. So it was pretty quick. Like literally right after I took NCLEX, I started. I had a really good preceptor who was really good at what she does. Steph, shout out to you, girlie. So yeah, I learned a lot of good things from her. And again, it was just like a shock. You're definitely going to feel a shock from being a student nurse to an actual nurse, because everything's just different now. You're starting from scratch now. You're dealing with real people with real personalities and all of that. And you're dealing with family members who are probably not going to be the nicest 24/7. Like, nothing is this perfect world anymore like nursing school makes it seem like it's going to be. Starting off in the ER, there's like ER specific things that you have to learn. I had to learn, stuff about sepsis stuff, cardiac alerts, intubation, describing a code, things like that nursing school is not going to prepare you for. It took a lot and it was very hard. Luckily, as a nurse extern, I'm happy that I had that job because I was able to, get my hands wet with starting IVs. That's very important as an ER nurse because, child, starting an IV like that, it's just a very important skill, and nursing school doesn't put emphasis on that enough. But if you are going to work in the ER or like ICU, that's important because that can really save a person's life. And then for me, one thing I feel like I struggled with a lot is your assessment skills as an ER nurse, because patients can go south real fast. You have to be mindful that when a patient's coming to the ER, like, this is their first line of care. So like everything's just fresh. Like, you're, stabilizing this patient right now. It's not like they came from somewhere where, they're on these meds to kind of help their condition. Like, no. There's people who've walked in, dripping in blood, people who come in gunshot wound, and like, it's up to you to, stabilize this patient right then and there. There's people who came in on, the ambulance talking, everything. You would think nothing's even wrong with them for real. Next thing you know, they finna get intubated and you have to pull an RSI kit. Like, you just have to be ready for that. And I think that as a new grad nurse, that could be very scary, but the strongest survive. So luckily, there's a lot of new grads that started around the same time as me. So we kind of had each other to, just kind of have that support, because we're all like coming into this brand new. It's very important to be eager to learn and ask questions, because now your license is on the line. Don't be too scared to ask, because somebody might think that you're dumb or that's something that you should know by now. Ask that question, because you just never know. Like, you don't want to go into a room doing something that you're uncertain of, and then now this patient's at harm. And now your license is too. When I first started, my manager actually gave us a list. Like, it was this folder. She gave us a list of meds that you need to study, because you'd be giving like meds like this in the ER, but they can kill you. So like, actually, like, they can kill you. Like, babes, if you give this wrong, you're done for. And I also just want to say, therapeutic communication is a lot. But let me not say it's a lot, but it's not always the thing that's going to work. Like, again, you're dealing with real people and different personalities. And I think that's one thing that I don't like about nursing schools, that they make it seem like everyone's always compliant and everybody's always so kind. But it's like, no, like, you get attacked being a nurse. You seen what happened to the nurse in Palms West. Like, things like that are true and they happen. So I think that if you're ever dealing with somebody who's like aggressive towards you, know when to step back and leave that room before things escalate real bad. It happens. Like I said, I was trying to put on a blood pressure cuff on somebody who was ETOH and literally swung on me for trying to do that. In nursing school, it doesn't teach you how to, deal with people who are ETOH and who are combative. But be ready for that. I feel like that's something that's very important, is knowing that not everybody is kind. You don't sit in that room trying to be therapeutic and trying to be their peace. No. If that patient starts raising their voice at you because they don't want no vital signs or they want nothing done, leave that room and protect yourself. And if they want to sign up AMA because they don't want nothing done and they're screaming at you, let them. Like, don't try to always play hero, because I think nursing school kind of teaches us to do that, because compassion's everything. And yes, it is. It's very important. But at the end of the day, you need to know when to walk away. Obviously, it's important to care for them. We love our patients. But you need to know when to walk away, because if somebody's getting angry, yelling, and combative, boo, leave that room. Clearly you're not dying because you over here trying to hit me. And then that brings us to our next topic. What nursing school doesn't teach you, but things that you need to know. Being able to tell when your patient is crashing. Let's talk about working in the ER as a new grad nurse. You have to grow up fast. At least the place where I work at, you do have to, grow up fast and show that you're able to keep up, or else you're getting sent to the floor. Luckily, I didn't get sent to the floor. I think anxiety is a very big thing working as a new grad ER nurse. But one thing that I learned over time is prioritization, assessing your rooms before you get that assignment. For instance, say I'm coming in, I get, my zone assignment. I go to my zone, I look at each and every room. This is just, quick scoping the scenery out. I look, I see 4 of my patients are sitting up on their phones, alert oriented, breathing fine on the monitor. No signs of any acute distress. And then I see one of my rooms, I see a patient has a bear hugger on them. I'm going to go to that room first. Obviously that'd be my more critical patients. Could there be tasks that I have to do with the other patients who are all stable? Could they maybe have meds due at this time? Could I got a bed upstairs I need to call report and all that? Yes, that could very well be a possibility, but I need to go into this room where my patient has a bear hugger on because now I need to check their temperature. What was the story? Why is their temperature that low to the point where they need to have a bear hugger on? Something that I had to learn with working in the ER is that, all your tasks are important. You definitely need to get them done, but you have to prioritize. There's always going to be something to do, but you're only one person. You're not going to be able to get it done all at once. So being able to prioritize your care and time management is something that you learn over time, and as you're running zones, you get better at it. Anytime I go into my shift, I always peek at all my patients' room and just kind of get off rip first glance, what's everybody looking like? Is there somebody where I need to do an immediate intervention or they're gonna die? That's the mindset you need to have. The biggest thing while being a new grad nurse, especially in the ER, is just be a safe practicing nurse. If you have to question an order, question it, because at the end of the day, doctors are human too. We all make mistakes here, but you don't want it to be a mistake that's going to cost you your license or that patient's life. You get better each shift that you do. You learn something new each shift that you do that could be important for the next coming shift. Keep working at it. Don't get discouraged. It is hard and it's easier said than done because you are dealing with a lot of self-esteem issues, anxiety, all of that, but everyone starts somewhere. So don't let anybody, act like, oh, you should know this already. You didn't wake up one day knowing how to do NTP or wake up one day knowing how to start an IV. We all have to learn these things. So give yourself grace. We were all new nurses before. And I just want to say, was this nursing journey very hard for me? Yes. It started, I think May 2023 is when my nursing journey started. It was not an easy journey. So many ups, so many downs. Lots of downs, but I will say today I am so happy that I did it. It's actually not even funny. I would not be able to have this YouTube channel, would not be able to travel, met the people that I've met without nursing. If you're thinking about, joining the nursing profession, I 100% advocate for it. There's just so many different outlets that you can do with it. You don't have to just be confined behind a desk like a lot of other jobs where you're only doing that one thing. There's so many different types of nurses. Again, if you want to work in the cath lab, if you want to do a travel contract, if you want to do home health, if you want to do ER, if you want to do soft girl nursing, all of that, you can do that with an RN license. So I hope that this video helped you guys. I hope that I touched on topics that you guys want to hear, and that if you are thinking of joining nursing, I hope this, helped. If you guys want to see more nursing content, let me know if you want a part 2, because there's so many things I could touch on. And just leave in the comments if there's any other questions that y'all have for me. I will happily answer it. Thank you guys for watching this video. Don't forget to like, comment, and subscribe, and I'll see y'all in the next one.
Can't get over you. You left your mark on me. I